All right, everybody. We'll get things going. It's about 1 after the hour. Want to start by saying thank you so much for all accepting our invitation to join today's presentation on our SmartCare Remote Management platform. We truly appreciate it. A few housekeeping items I just wanted to talk through before we get going. First of all, let me introduce myself. My name is Kevin Payne. I'm the Associate Director of Regional Marketing for our patient monitoring category, which includes our SmartCare Remote Management platform, and I'm really excited to talk to you more about it today. Before we get going, a couple things to consider. We're going to be handling all the Q&A for the presentation through the chat function. So as we go through our conversation, if you have questions, please put them in the chat, and then we'll actually be addressing those at the end of the presentation, so we'll have time to hit through everybody's questions. I think today's presentation will probably take about 30 minutes or so. And I encourage you, if you do have questions, please put them in the chat. And then also be thinking about the fact that after we leave this presentation, we will be sending out a recorded version to all of you. We'll have some resources that get into a little bit more detail about the platform that we'll share out as well. And then we'll also have the ability for you to engage with your local account teams to have a deeper conversation around SmartCare Remote Management with them subsequent to this presentation. So there's definitely an opportunity to have more conversation. This is a little bit of a primer. And really what we're here to do today is talk a bit about some of the key challenges we're seeing in terms of device management today, some of the challenges that I'm going to make the assumption I think you may be struggling with one or two, and talk about how SmartCare Remote Management can really help address those challenges, especially in an environment where you're trying to maintain and manage a deployed fleet of connected devices. So we're going to talk a little bit about the challenges. I'm going to talk a bit about what SmartCare Remote Management is and how it works. And then we'll jump into a live demo to give you a first-hand look at how the platform works, what it looks like, and really what an experience of a user would be in a first-hand capacity. So again, really excited to talk through this with you guys. We'll dive in now. If you have questions, throw them in the chat, and we look forward to an engaging conversation. So let's start. So your world can be chaotic. That's an assumption I'm going to make. And when it comes to managing devices that are on your network, managing a fleet of connected devices, there are a lot of things to think about as far as challenges and concerns, some of which are really rapidly emerging today as new trends. And we're seeing this a lot with customers. And a few things, when it comes to our specific type of products, our Connect monitors that come up quite often would be, a handful of things. First of all, obviously these devices are mobile. They're used throughout the hospital. In some cases, they're used in clinics. And oftentimes, addressing updates or enhancements to those devices does in fact require physically getting the device and either bringing it back to the biomed shop or addressing that update, potentially on the clinical floor. So it requires that individual to go out, get the device, and kind of handle that, which takes time, and it takes some digging as far as locating where that device actually is throughout your facility. So that's a challenge, right? And we know that everybody's pressed for time. Everybody's trying to do more with less. So thinking about ways that we can help you alleviate that challenge of wasted time going to find devices, and then in some cases going through very manual processes to go through an update or to update the configuration as an example of a device. So thinking about how we can take the fact that valuable time is wasted in several areas and really try to eliminate or reduce that as much as possible. The next thing is cybersecurity, right? And obviously, as we talk about devices that are connected to your networks, this is something that continues to evolve as a concern with customers, and an area where we're hearing customers say, number one, I need to understand what I have out there in my fleet of connected devices. What version of software is on these devices? How can I kind of assess the status of the fleet that I have out there? And then secondly, give me tools or help me really mitigate some of these cybersecurity threats by helping me really manage that fleet of devices that's out there and connected to my network. So this is obviously a concern this is an ongoing challenge, right? It's not something that we look at as a static situation. That's something we know that has to evolve over time. And obviously, it's a challenge that you're faced with. So we're going to talk a little bit about how we can help make management of that, fleet of connected devices hopefully simpler and give you more power to control that fleet of devices you've got throughout your system. And then lastly, from an asset management perspective, help me understand what's out there, right? And whether that means how devices are configured, whether that means the model of what devices I have out in my fleet, serial numbers, or even the versions of software that are on those devices I have throughout my fleet. Getting your arms around that, starting with day one when those devices first hit the floor, but then subsequent years as you add monitors over time, that fleet grows, that information changes. How can we help you get your arms around that information and do a better job just getting visibility to what's actually out there so that you can manage and maintain it according to your standards? So that device data, we definitely associate the fact that that's becoming more and more important to help you understand that information, but just as importantly, accessing that information in an easy way, which I know can be a real challenge. So, these are sort of the three big challenges or concerns that, we kind of equate to chaos right at the moment, as far as having a fleet of devices throughout your health system and really trying to get your arms around what's out there and managing and maintaining those devices in a simpler, more efficient way. And that's really the crux of our conversation today with SmartCare Remote Management, as far as a platform intended to really help you do that more effectively and more easily. So as you could probably kind of assume at this point, right, this is all about managing these devices or these endpoints that are on your network. So very much from an IT or a biomed perspective, SmartCare Remote Management is really not tied into necessarily the clinical functionality of the devices. It's really there to help you manage and maintain the devices that are out there in the fleet. And so as we're talking about, what products are compatible with this platform, many if not all of you are current customers, and so we're truly appreciative of that. And I think you're going to be pretty familiar with the devices that I'm showing up here on the screen. But our Connect's Vital Signs Monitor, our Connect Spot Monitor, and our Connect's Integrated Wall System are really the three products in the portfolio that are compatible with the SmartCare Remote Management platform. And so the key obviously is, once you have these devices connected to your network, this is where the SmartCare Remote Management platform can really kick in to help you take advantage of some of the benefits that we've talked about. And so at a high level, the concept here is really helping you take control of that fleet and do a better job staying out in front of challenges and really managing what you've got out there on your network. So enabling more consistent and timely management of your patient monitoring devices. So our conversation, again, is very specific to the Connect's portfolio of products. Easy access to that up-to-date device details. So this is going to include the location of devices that are spread throughout your facility, and I'll show you guys what that looks like and how we do that. Gives you access to versions of software that are on these devices, so you have visibility to the assets that are out there and the versions of software and the versions of configuration files that are out there at the device level. And then lastly, an element of helping you be proactive, right? So giving you visibility to things like battery cycle counts, which I'll walk through with you, sensor utilization, so that you can, hopefully get out in front of maintenance activities or intervene when a device may require some form of service before it gets to the point where, clinical has to call and say the device is no longer working. We have to have you come and pick it up from us. So, those are the three key benefits as far as helping you get your arms around taking control of that connected fleet of devices you have out there and doing it from a centralized platform that makes it very, very easy for you to access this information, but also execute updates. And we're going to walk through all of that as a part of the demo we're going to go through today. So let's talk about how it works. And I just want to do a kind of a high-level description of the SmartCare Remote Management platform and really how it really kind of intersects with a connected solution that you've got in your facility, right? So we're going to make a bit of an assumption up front, right? Obviously, you've got Welch, Allyn, Connect's monitors in your facility. And then another prerequisite or another sort of necessary thing to be in place would be these devices are connected to your network. So likely that means you have those devices connected into your EMR and your clinicians are able to send information directly from the devices into the EMR. SmartCare Remote Management really kind of lays on top of that connected system and really serves as that service platform for you to engage with all of those connected devices. And how we do that is giving you access through a cloud portal that is specific to your universe of connected devices. So think of this as a cloud portal that the users that you determine would have access to this are able to sign into and then get visibility to all of the devices that you've determined they have visibility to. And I'll explain to you guys what that looks like when it comes to the actual demo and kind of how the system gets architected from a user's perspective. So the key here also is this is very scalable. As you add devices to your connected fleet, as you potentially add more connectivity to other hospitals, as an example, if it's in one hospital today and you're expanding your connected system out to other hospitals within the health system, SmartCare Remote Management can really flex with that growing requirement. So as you add new devices and new connected facilities, SmartCare Remote Management with its cloud-based infrastructure is really designed to grow with you. So those devices are easily accessible. We can add devices. We can add new facilities as you grow with us. And then the last point that's really important, and I kind of talked about this, briefly as far as the clinical aspect of this, or the lack thereof, I should say, is that we are never interacting with patient health information in this platform. So the remote access that we're taking advantage of to allow you to really manage and maintain these connected devices is not interacting with any electronic patient health information on the devices or information that's getting communicated from the devices. This is purely related to service-only data. So we want to be really clear about that because I know that's a question that gets commonly asked as far as the risk of PHI exposure. And this portfolio, this platform does not interact with PHI. So I know that's a very common question and a really important question to make sure that we clarify. So I'm going to actually go through a demonstration of the platform to give you some visibility to what does this actually look like, right? As a user of the tool, what do I see, what do I have the ability to do when SmartCare Remote Management is deployed at my facility? So I'm going to go over to a demonstration portal. And we're going to start by talking about just the login process, right? So as I mentioned before, this is a cloud-based platform. So your users are going to access the tool by simply signing in to a secure web page that's going to give them access to only your account within SmartCare Remote Management. And it's going to be even more specific in that it's only going to give that user access to the specific facilities or devices that they've been granted access to. And so we can control that in a few different ways. One way would be that that user gets a login, username and password, where they simply sign into the portal. And as a user, they are going to have the ability to view certain things within the portal within your health system. To make things simpler, we can also have the platform integrate with your Active Directory system so that we make that login process very seamless and simple, similar to other applications you'd have in your internal network. So we can actually have the user just do a single sign-on approach to signing into the platform, and their credentials would guide what they have access to inside the portal. So we can handle that one of two ways. On the back end of that, there would be somebody who is an administrator at your facility, and that person really has control over who has access to the platform, as well as what visibility they have when it comes to the various hospitals within your health system. So that's all controlled by you. We really assist with the upfront setup of how the platform would be constructed for your institution, and then from there, your internal administrator really takes over from managing who has access to the platform and what they're able to do with it. So the next step we would do as a user is we're going to log in. So I'm going to go ahead and do that. Try that again. Might be a Murphy's Law situation. There we go. All right. So now we're into the portal. So I'm signed in, and really as an example of what a user would see, I'm now signed in as a user of the platform, and I'm signed in as Pain Health System, right? So my health system is indicated at the top, Pain Health, and then in my particular case as a user, I've actually got access to manage devices at 3 different hospitals within my health system. So that's been kind of determined by my administrator, and I'm responsible for managing and maintaining the equipment at these 3 different locations. So this is the first page I'm going to see when I sign in. And you'll see I get some pretty basic information in terms of each of these 3 facilities in terms of what's there, right? So I've got 1 connectivity server deployed at Mercy Hospital. I've got 50 Welch Allyn patient monitors deployed at that facility. And then I won't go into any more detail on this, but you'll also see there's a number of beds that's included here. This platform can expand out beyond just Welch Allyn patient monitors. We actually have the ability to also connect to our Hill-Rom beds, as well as our Welch Allyn vision screeners. So there's other capabilities to manage more devices beyond just patient monitors. I'm going to focus in on specifically patient monitors for today's conversation. So getting back to that point, you kind of get a high-level summary of each facility and what's there, right? So 50 devices, 25 devices at East, and 25 devices at West. So it gives me a high-level indication of what I've got connected at each of these 3 hospitals. From here, what I could do is actually drill into any one of these facilities, and now I start to get into deeper level details of the fleet at each of those hospitals, and I have the ability to do some of the more detailed work as far as looking at more granular information around the monitors, as well as executing updates and those types of things, which I'm going to step through with you guys in just a moment. So let's use Mercy Hospital as sort of our demonstration facility, and we're going to walk through that as far as some of the other functions available inside SmartCare. So I'm going to click on Mercy Hospital, and what happens when I do that is it's now going to bring me into a page that is all the details about my connected devices inside Mercy Hospital. So you see here I've got a page of various vital signs monitors that are inside Mercy Hospital, and in this case I've actually got a mix, right? So I've got some Connect Spot monitors, I've got some Connect Vital Signs monitors. So you don't have to have just one or the other type of device. Depending on what's deployed in your hospitals, we have visibility to all the devices that are connected and are compatible with the platform. So when I go into the Mercy Hospital main page, I've got a listing of all the devices that are connected. And then obviously, as you can see, I know what type of device it is. In this case, I've got a column for status with an indicator on it. I'm gonna go back to that and explain to you guys what that indication or that exclamation point is telling me. I can see what version of firmware is on that device. I can see the configuration file that's on that device. So, the configuration file is really kind of determines the behavior of the monitor when it comes to clinical settings and network settings. So I can see how this device has been configured. And then I've got an asset tag. I've got a serial number for that specific device. I can see where that device is. I can see when it was last connected to my network. And then lastly, over on the far side there, I can actually see a preventive maintenance due date for that device as well, which is recorded inside the platform. So it kind of gives me a snapshot view of all the monitors in the hospital, and then some really high-level information about each of those specific devices. A couple quick other things. I can obviously sort this list. If I only wanted to look at my Connect Vital Signs monitors or my Connect Spot monitors, I could filter that to only see one or the other to kind of drill down to a particular type of device. And then also, if I'm looking for something really specific, I can type into the search menu. If I know a serial number I'm looking for, I can type that in and narrow the list down even further as far as the devices that I'm viewing in this screen. But kind of my main page as far as all of my connected monitors inside Mercy Hospital in this case. So from here, what I can do is really drill into more specific device detail. So let me give you an example. We're going to go into this Connect Spot monitor. I'm going to click on that. And this is where I'm able to see very, very granular information about a particular device. And I may be going into this area if I'm trying to do troubleshooting, as an example, if I'm looking at preventive maintenance scheduling on this particular device, or if I need just more further diagnostic detail about a specific monitor. This is where I can drill in and get the details on a particular device. So as you can see, I've got some basic sort of overview information about the device. I can tell what type of a Connect Spot monitor it is through the model number. I can see that last connected information, the configuration file on it. I can actually get a MAC address for that device from this screen. So think of this as the sort of that individual personality of that specific monitor is available when you kind of click into that specific device. I can also see down here, a preventative maintenance schedule update for that particular monitor. In this case, just to kind of show it a bit, I'm obviously well overdue, but I have the ability to see the preventive maintenance status on the monitor itself in this view as well. So let's navigate over to some more device information, and I'll talk about what this little exclamation point is telling me as well, because one of the capabilities of the tool is that we can actually give indications of when a device may require service or attention, with the goal of helping you be proactive, right? And basically giving you an indication that a device may need attention, as I mentioned, for certain reasons. So I'm going to click into component information, and this is going to give me a lot of very deep detail about the device itself. So this is where I can see versions of firmware on the device. I can see the type of battery. I can see the type of 802.11 radio contained in the device with a version. So again, very, very deep, detailed information. When I'm looking at individual devices or my fleet, this gives me visibility that I wouldn't normally have unless I had the device in front of me. And typically, I'm in the advanced settings area, kind of going deep into that individual monitor. I'm able to pull this up right on my computer, from my desktop. Now, in this case, you'll see I've got my exclamation point, right? And that's next to the battery. So that's actually a really important indication. What that's telling me is that, in this case, the maximum capacity, the charge life left on my battery is all the way down to 5%, right? So what we've tried to do in this case, and it's starting with battery life, knowing that that's a really important feature of the devices, is we have a capability built in that once your recharge capacity goes below a certain level, we give you an indication so that, ideally you can be proactive and replace that battery before the device no longer holds a charge. And again, clinical is saying the device isn't working and you have to go retrieve it from the floor. So we can also report this information at a bigger picture view, which I'll show you in a moment. But when you pull up that list of devices, you see that exclamation point indicator. That tells you that something's going on with the device that you can click into and get a better understanding of what condition's going on. And then also, again, to that point, be proactive as far as going and addressing that problem with the device. So one other feature here that I'll talk about really quickly that's more of a troubleshooting capability is log files. So again, log files for the device are extremely helpful for us, especially when you're engaging with our technical support team. And a log file coming off of the device commonly requires somebody to go to the device, put in a thumb drive, and download that file onto the thumb drive so that you can either look at it yourself or you can email that off or share it with our tech support team so they can look at some of that diagnostic information about what's going on with the device. And it really helps us drill into issues that we might be having a challenge identifying what's going on with the monitor, or if we're seeing a recurring issue, we need to really dig into that particular device itself. So a lot of manual work required in getting log files, but log files are extremely valuable in troubleshooting. If I'm inside of the SmartCare Remote Management platform and I know a particular device, whether it's by serial number or an exclamation point indication, is having an issue, I can actually request a log file remotely from inside of the portal and actually download that directly to my computer through the platform. So this totally prevents me from having to go get the device. I'm actually able to retrieve the log file right from my desktop, save it, and then I can open it up, look through it, or email it off to our tech support team so that they can review as well and kind of assist through that troubleshooting process. So again, the goal really is to help that process be a lot simpler and more efficient, so that you save time versus going out onto the floors and actually having to physically retrieve those devices. So one more thing I'll talk about when it comes to actually physically retrieving a device where we can also help. You may notice up here there's a locate asset button that's assigned to each of these devices as well. And so if I click on locate asset, what that's going to do is pull up a window, and that's actually going to tell me physically approximately where that device is. And so we're actually able to do this through the platform by using access point mapping. So we're not requiring any additional RFID tags for locationing. This is actually done through the wireless radio built into the monitor, and then triangulating that with your access point, again, to give an approximate location of where that device is. As a part of the setup process, we would work with you on an AP mapping that would go into the tool so that we can then identify, based on the connection, approximately where that device is, to help you, if you do have to go onto the floors and retrieve that device, determine physically where that monitor is in the hospital without any additional technology really being installed on the device or attached to the device to do locationing. So quite a bit of functionality when it comes down to the individual monitors themselves that allows you to get into very, very detailed information on the devices. One of the other things is in terms of getting your arms around that broader fleet of devices that are out throughout your hospital or throughout your entire health system really comes through the reporting functionality, where now we're talking about going from an individual device level to a more broad-based, let me look at my entire fleet and draw some insights as far as what's out there, right? And looking at some broader information about my deployed fleet. So I'm going to navigate away from the assets, and I'm going to go into reports. And similar to the other screens that we were in, I can choose to run reports based on different types of devices. And then there's a series of different reports that are available automatically in the tool. And I'm going to walk through a few of the kind of the more high priority or more prominent reports that we see used on an often basis. So I'm going to start by usage. So think about the usage report as, again, helping you get better information around the frequency or how often or the wear and tear that your fleet of devices is experiencing. So if I click Get Report and I run a usage report on my Connect Spot monitors at Mercy Hospital, I can see a few things. I can see a breakdown, in this case, of where my devices are, so between the ER and the med-surg. And then more importantly, I can go down and I can look at that series of devices, and I can actually look at utilization information that might help me drive some insights as far as devices that are getting used really hard or devices that are getting used on the lighter side from a wear and tear perspective. So as you can see, I've got my monitor, my asset tag, which I would have entered on the device. I determined the asset tag, the serial number, and then I'm seeing battery cycle count for that particular device, the number of cycles on my SureTemp thermometer in this case, and then NIBP sensor cycle counts, as well as what would be pulse oximetry sensor count as well. So this kind of gives you a sense of devices that might be in a certain area of the hospital or other areas of the hospital. Are they getting used really hard? Are they getting used a lot less than others? Potentially giving you the ability to maybe redeploy assets so that devices that are getting used heavily maybe get deployed to an area where they get a little bit of lighter use, and then reorganizing your fleet to kind of spread out the burden as far as how the devices are being used. It also gives you visibility to devices that are being worked hard and may require some form of maintenance, or just be aware that devices are getting worked hard, and just be on the lookout for battery change requirements and those types of things that just come from heavy use. So the utilization report's really there to help you get visibility to how hard are these devices being worked and what might I need to keep an eye on from a maintenance perspective in terms of my fleet throughout the hospital. So the next report I'm going to go to out of my list is I'm going to go to the firmware version report. And this is also something that, as we go forward, especially really managing and maintaining and understanding the various versions of software that are on devices that are deployed throughout your facility or throughout your health system is increasingly becoming a question. And that's also something that may be recorded in an asset management report when you first receive the monitors from us. But it's also something that over time, if you're performing preventive maintenance, you do a firmware update, that information is tough to record. And over the past several years, we have released subsequent versions of firmware for all of these devices. So at any point in time, the version of software that we're shipping versus the version of software we have today could be different. So this report is really intended to give you visibility to what's out there, right? What software is loaded on all these different devices that I've got out there, and where may there be devices where I have the opportunity to upgrade to the latest version, as an example in this case. So I'm doing pretty well as far as my devices at Mercy, because they're all on the same firmware version at this point, right? So my total number of devices is 25. All of those devices are on 1.42. So they're all at a consistent version of firmware. They're all on the latest and greatest at this point. So we're in good shape. If I wanted to, I can also break it down according to these different areas of the hospital where these devices have been provisioned, and look at my status as far as the devices in the ER versus the devices on the med-surg floors. So it gives you visibility to your overall fleet, but then if you've got them provisioned in different areas and you've got them organized according to different care settings, you can get some visibility to where these devices reside as well. So the next report I'm going to talk about is what we call activity. And at this point, this report is very, very centered around the conversation of battery life, right? Which obviously is very important. It's a typical replacement item over a period of time. Batteries get worked hard, but getting visibility to the status of that battery, the remaining capacity, so you can kind of plan out in advance where batteries may need to be replaced, is challenging because you really don't know until you're in front of the device looking at it, as far as, you know, how much charge does that device have, and then what's the capacity remaining on that battery, so I can plan through a replacement cycle. This report actually gives you visibility to all that right from your desktop. So again, at a device level, I can see my individual monitors. I can see the actual charge on the battery, so how well is the battery charged at this point. I can see how many cycle counts that battery has run against it. And then I can actually see the capacity on my battery as well. So how much charge can it accept? So I'm doing really well, right? 96% charge. The battery still has 99% capacity on it. And then based on that information, we actually give you a recommended indication of, is this battery a candidate for replacement, with a simple yes/no indication. That's not a required replacement, it's a recommendation, right? Based on the numbers that we're generating over here in terms of the status, the health status of that battery. As you look down a layer, you'll see that this particular battery has 7% charge left. It's had a lot more cycle counts, and it's only got a 4% capacity left on that battery. So we would recommend that's probably a good battery to look at for replacement. And again, this gives you visibility to this detail on all these devices in a single report that you can actually download or print right out of the portal versus having to go and look at each individual device. This would also correlate back to the exclamation point indicator we looked at earlier at the individual device level, where we were seeing that a battery capacity was running pretty low on that single device we looked at in the asset tab a bit earlier. So this just gives you a bigger picture view of your battery status across all the devices in this particular facility. The last report I'm going to talk about with you is a newer report we've just added to the platform, which is our CMMS report. And really what this is a report that you can generate to really get all of the details of the devices that you have deployed at the hospital and download it into a CSV format that you could then take and upload into your CMMS system, like a Nuvolo as an example. So what we try to do here is take all of that up-to-date current device information that we're storing and giving you access to inside of the platform and making it something that's downloadable and then consumable by a CMMS platform, so you can help manage the information you've got in that device management platform and try to keep things consistent with what we're seeing more in a live capacity through the SmartCare Remote Management platform. This is a relatively new report. This is something that's evolving, but one of the great things about the fact that this tool is a cloud-based platform is we have the ability to consistently roll out new capabilities, new reports, new functions, and you essentially get immediate access to that based on the cloud-based nature of the platform itself. So you don't have to wait for us to release a new version of software, and for that matter, with this particular platform, we make those updates available to the cloud community, and then you have access to taking advantage of those. And so the CMMS report would be an example of one of those newer reports we've really recently added as a new capability inside the platform. So that kind of really hits the highlights of all the key reports that are available to you to look at that sort of macro or bigger picture view of your fleet of devices. The last thing I'm going to talk about is updates. And so we talked about looking at the individual devices you've got in your facility. We talked about looking at the bigger picture through reporting of demographics and sort of some bigger picture insights into all the devices through reporting you've got in your facility. Updates are really the area where you can actually execute a change to those devices. And when I say that, this is an area where you can primarily do one of two things. It's going to be either a configuration file deployment, so like I said, kind of changing the behavior of a device, adding clinical functions, maybe changing network settings, adding security functions. Anything you can do with a configuration file would be something that you can do by deploying a configuration through the platform out to your connected devices. The second update that's going to be available, and I'm going to choose a Connect Spot monitor as my test case here. The second update that's available through this capability is actually pushing firmware out to deployed devices as well. So the one thing that's important to note on the firmware conversation is that firmware upgrades are unique to our Connect Spot monitor device. So that's a device that has capability to accept software remotely, as well as configuration files remotely. The other devices in our portfolio, the Connect's Vital Signs monitor, which if you're familiar with that is the larger device, as well as the Connect's integrated wall system, can only accept remote configuration files. We can't push software out to those, or firmware out to those devices. So that's just something to be aware of. The Connect Spot monitor can really accept both updates. However, everything else we talked about from a reporting perspective, from a device visibility perspective, when you drill into the individual monitors, that's available across the entire portfolio of patient monitors. So it's really the update capability that has some variability depending on the type of device that you're managing. So let me start with giving you an example of a configuration update. So I would choose the type of device that I'm configuring, and then I'm going to choose the update type of configuration. And what's going to happen next is that the platform is going to know that I have a few configuration files available to me that I've created, right? And these would be common terminology names that you've created, right? In this case, Pain Health 2 and Pain Health 1 are the standard configurations for my health system, right, that I've created. So I've got 2 available configuration files in the platform. I would choose the configuration that I now wanted to deploy to the monitors that I'm going to select. And again, I'm sure you guys are very familiar with what our configuration files can do, but think of this as I can add new clinical, entry points on the device as an example. Clinicians have the ability you can change alarm limits on the device through configuration files. Network settings get applied there. So it really, as I said earlier, kind of determines the behavior of the device and the performance of the device. The configuration file drives a lot of that. And typically this is one of the things that's very custom to your facility as far as clinical workflow and also network settings as well. So I've got 2 approved configuration files in my account. I'm going to choose Pain Health 2, and I'm going to click Next. And now what I'm brought to is I'm brought to a screen of all the devices that I've got inside of Pain Health and Mercy Health specifically, right? So this is giving me the ability to now say, okay, are there specific monitors that I want to configure this way, or do I just want to basically do the select all function and check the box for all of my Connect Spot monitors that I'm going to push this configuration out to through this function. So I'm just going to choose all. I'm going to do a standard configuration across the whole hospital. I'm going to click Next, and I'm going to get one last chance, right? It's going to say, okay, so you're telling me you're going to push this configuration file out to all the devices in this single location. Is that definitely what you want to do? And I'm just going to confirm that that's what we're going to do. And then this is going to disappear quickly, but it says update has been processed. So what's happening now is that configuration file is getting pushed out into the cloud and then will be pushed down to the monitors that I've selected. And the process can be one of 2 things at this point as far as how that config file actually gets deployed to the actual device itself. It can be deployed and actually applied to the device through a power down function. So in the case where you're doing a configuration update, the team can be informed that a configuration update will be occurring. Once it's done, we're going to tell you that the devices all need to be power cycled, and upon that power cycle, the configuration file update will be applied to the device. The other alternative is that there's a setting in the platform to auto-apply the configuration update so that power down cycle doesn't have to occur. That's a setting inside the platform that you would really determine. The one caveat to that is we will never interrupt clinical use to apply an update. So that wouldn't be a concern that we would update something in the midst of a clinician taking vital signs on a patient. The devices and the system is smart enough to know not to do that. So once that's done, the configuration file is pushed out. There actually is a report that I kind of glossed over previously where you can look at your list of devices and understand, has the new configuration file been applied to any of these individual devices or not? So that kind of gives you the ability to keep track of whether or not devices have received a configuration update. If they haven't, as an example, if they've been powered off, put in a closet for a period of time, when that device is powered back up, it will go out and look for updates, and if that configuration file will then be retrieved and placed on the device. So even if everything's not on and available at the time when you do this process, those updates can still be applied when the device comes back online. So there's a process for that to occur as well. So pretty straightforward. I'll go back to my Updates tab, and very similarly to what I just did from a configuration file perspective, the same process is really going to occur if we're talking specifically about a Connect Spot monitor to do a firmware update. So instead of configuration in this case, I would choose Upgrade. And then, again, very similar to what we saw with the configuration option, the platform has the ability to see what the latest version of firmware available for the device is. And so I can choose, in this case I've actually got two options because there's a service release mixed in there. I can choose the version of firmware that I want to push, and that's not something you actually have to upload. That's something that's available inside of the platform when that version of software becomes available. I can choose the version of firmware I want to push to my Connect Spot monitor specifically in this case. I choose Next. And then again, very similar to the configuration process, I have the ability to select which devices I want to push this version of software or firmware out to. And so if I did the same thing where I just did a select all, I said next, it's going to give me that interrupter telling me that, okay, you're getting ready to push this version of software out to these devices. I would click confirm, and my process has been established. Similar process that we talked about with the configuration update, whereas that firmware version is going to be placed up in the cloud. The devices are going to look for available updates. The firmware will be pushed down to the device, and then the application of that firmware typically will happen through a power down cycle, but we do have the ability to auto apply as well. And again, that's a setting that would be determined inside of the platform as far as how updates will be processed when they are pushed out to deployed devices. Same rules would apply as well. If a device is offline, it's powered off. When it powers back on, the device will go out, look for any available updates, and be able to accept either that configuration file or, if it's a Connect Spot monitor, a firmware update that has been applied to the broader fleet. When it's back online, it'll be able to accept that update. All right. And then if I'm back at my Asset tab, I'm kind of back home as far as the area where I can see all of the devices back at Mercy Hospital. If I wanted to, at this point, go back to another location, I can navigate back to my main screen and go through all the same steps, whether it's at East or West Hospital or many more facilities. We do have customers that have many more than 3 hospitals that are being managed. But that process kind of carries through for the devices that are available through the platform for you to work on and activate against. So that's really it for our demo of the platform. At this point, we're about 45 minutes in. We just wanted to open it up. We know we've got a few questions inside the chat, and I can address those. People are free to stick around. We've got until 1 o'clock Eastern time booked for the webinar. We're happy to stick until that time. But why don't we run through some of the open questions? If there's anything we don't get to, we can certainly provide answers back as a follow-up to the webinar. The other thing I did mention early on is this is being recorded. We're going to share a recorded version of this presentation out with the attendees. And then we do have some great resources that get into more detail around the platform we will share out with you as a thank you for attending today's session.